Okay, so the intervention has a rationale behind it. So uh, every time you introduce a new therapeutic drug or a new intervention or a new procedures, you cannot just say that it works because you tried it once or twice or three times and it worked. You need to have the control group to compare to that control group, and basically also because most of the interventions we work nowadays don't have such a drastic effect that would make the use of a controlled group non-useful. The counter argument is the penicillin. So penicillin was when penicillin was introduced, it reduced the mortality rate of pneumococcal pneumonia from 95% to 15%. In such a case, you don't need to do clinical trial. The advantage of using penicillin is obvious. It has a very strong effect and it's very clear. You cannot argue against it. Whereas for most things that we do nowadays, actually we need to do a clinical trial. We need to do an intervention to be able to show that it works. So that's for the intervention part. What about the control group? Well, the control group is a group that supposedly looks exactly like your intervention group, with one difference that these people will not receive the intervention. And therefore, they should be about the same age, about the same gender distribution, same socioeconomic status, same background, same everything. Um, Except that they don't receive the intervention. And why we need them? We need them because you want to know what would happen if had you not intervened. So think about if you're dealing with pain, for example, and you provide a treatment, and a few hours afterwards, pain is gone. How do you know that pain is actually dissipated because of your drug and not because actually it's going to go by itself? Therefore, you need to have a control group. You need to have a control group that will tell you what would happen in the absence of the intervention. And therefore, you can use the control group to show how much of a difference your intervention has introduced. Now, what kind of control group we have? Well, you can have a control group that doesn't receive anything, so no intervention. You can have a control group that receives the alternative treatment, the standard method of treatment, or a delayed treatment. But probably the most widely used one is the placebo. And when we're talking about a placebo, we're talking about trying to control for the psychological effect of receiving a treatment. And there's a lot of evidence and literature that shows that when a patient or when a person perceives that they're receiving a treatment, there will be an improvement. But that improvement doesn't last long and is just due to this psychological effect. Therefore, the idea of a placebo was introduced, and when you're dealing with a drug, a placebo should have the same size of the regular drug, the same color, the same packaging, and everything. And otherwise, it's pretty simple to have a placebo for a drug. But sometimes you're not dealing with a drug. You're dealing with an intervention that is not a drug. It could be a training. It could be some sort of exercise, and therefore the placebo is not straightforward. But you should have a placebo. So, for example, if you're giving a group of people some training, educational material, and to see how much this educational material is going to benefit them, a placebo here would be a material that resembles the intervention, it resembles the training material, except that it doesn't include the intervention. It doesn't include the training. It can include literature about painting, literature about history, about geology, anything. But besides that, the placebo group will receive some sort of material so that everything else besides the actual training is there for them to account for the psychological effect of having to receive this package. Now, randomization is the last piece of the three criteria, and randomization is very important. And let me start by saying that it shouldn't be so some people think randomization is random selection, and these two concepts are very different. Randomization is one concept, random selection is a different concept. So let's talk about the two so that we don't confuse them. Random selection, which is not what is part of the clinical of the intervention criteria. Random selection is basically when you have a population, and you want to take out of the population a group of people to participate in your study. So let's say LAU students, I want to take a group of LAU students to be part of my study. If I go by a random process of picking students from all LAU students to be part of my study, that is called random selection. You're not choosing because of some sort of a bias. You're choosing randomly. Everybody gets a chance to be part of your study. Well, this is random selection. It's not randomization. Randomization is when, like, you're doing a clinical trial, you want people to come in and participate in your trial, and people, some will get the treatment, some get the placebo. You don't get to do a random selection. You're just going to have volunteers that are going to be part of your study, volunteers that may be referred from their own medical doctors. And once they come to your study, they understand they may receive treatment or placebo. So what is randomization? Another word for randomization is random allocation. This is the process through which people will receive either arms of the treatment, and the treatment versus placebo, at a random effect, at a random style. So the physician doesn't pick who gets to take what. The patient doesn't pick who gets to take what. The follower, the people doing the follow-up, the research assistants, nobody gets to pick. It's just purely done by random process. Okay? And why do we need randomization? Well, randomization, what it does, it makes the treated group and the placebo group similar with regard to background information. So remember when I said that your control group needs to be very similar to your intervention group, with except for the fact that they're receiving the intervention? Well, that's what randomization does. Even if you have a group of people that are not randomly selected from the population, even if you have a group of people that are volunteers, so there is some sort of selection process that happened before they joined your study, randomization is going to split them into two groups that are equivalent, that are very similar. And then one of the group is going to take the treatment and the other group is going to get the placebo. Therefore, if you observe any difference at a later time point, that difference is going to due to the treatment, not because of an inherent bias that already existed in the two groups. Okay, so here's an example of what is not a randomization. In a study comparing medical surgery to medical treatment, younger and healthier patients were sent to surgery more often than older and sicker patients. So there was some sort of a selection bias happening here. Physicians were sending those that were younger, healthier to do the surgery, whereas older, sicker were given the treatment. And obviously what that created is you had now two groups. One group healthier, better, another group worse prognosis. And the healthier, the better, we're going to surgery, and the worse prognosis we're going to treatment. Therefore, the study found differences in the surgery versus medical treatment. But that difference was not due to the treatment, it was due to the bias in who gets to take what. This slide is an example of a randomization that occurred in one of the studies. So it's a huge study. You have about 11,000 participants. They were randomized into two types of care: stepped care and referred care. So referred care is the regular care, while stepped care is like they did some step up way of follow up with patients. And what you have here is they're comparing the two groups with regard to baseline characteristics. And if you look at the percentages, for example, of white male, regular smokers, history of myocardial infarction, you will see that the percentages between the intervention, yani stepped care, and the control, yani referred care, are very, very similar. And that happened just because of the randomization process. Now, you have a small quiz here which says, since randomization is done to make the experimental and the control group comparable at baseline, can the researcher allocate the participant into two groups of the study while making sure they are comparable? يعني مثلا بيجي a person that is a male that is age 50 to 55, that is highly educated and that has a past history of cancer in the family. Then this person is put in the intervention group. Now the researcher goes and try to find someone who is very similar to that person to put him in the control group. Can that be done? And here you have four options, the A, B, C, D. So A reads, yes, it's a good idea. B, no, it's very difficult, not to mention time consuming. C, no, it requires knowing all the background information, which is not always feasible. And D, yes, can be done only when participants are volunteer. Well, the answer is no. Now, between B and C, which one you pick, both of them are correct, but C is more correct than B, because yes, it is very difficult to do, and it's time consuming, and it's actually complicated, and sometimes it's not even possible to do. But also C introduces a piece of information where what actually we're saying is that it will require you knowing a lot of information which sometimes you don't. So sometimes نحن بنعمل randomization and the two groups are equivalent with regard to things that you never measured, maybe like genetic information. You never measured genetic information. But with proper randomization, they will be very similar. So how do we do randomization? Well, there are different ways to randomize. Like a very simple way, you can write numbers. Let's say your study is going to recruit 100 participants, so you put 1 to 100 on pieces of papers, and you put them in a bowl, and then you start picking from the bowl, the bowl numbers, and the first one goes to treatment, the second one goes to placebo. That would work. Obviously, there are more advanced ways to do that, specifically using computer algorithms, and where, again, you randomly allocate them into either getting the treatment or the placebo. As long as it's done randomly and 100% randomly, and there's no other pseudo-randomization process happening. And maybe I have an example of pseudo-randomization, but let me first do this quiz. A researcher seeking randomization in a study decided to let the participant pick into which arm they would like to belong. Is this randomization? The answer is no. It's not randomization because the participants are picking. As we said, when you're randomizing, people go into treatment arm or into intervention arm by a random process, purely random process. Neither they pick, nor the physician pick, nor the researcher pick, nor anybody picks. It's just randomly done. So I talked about pseudo-randomization. What is pseudo-randomization? Well, this is something that sounds that it is randomized, but actually it's not. Like, for example, when you start putting people into treatment versus control group based on their date of birth. And so if their date of birth is even number, they go into one arm, odd number goes into another arm, or based on their medical record number. It's not random. It doesn't work this way. Masalan, some people say, well, those that come Mondays go to the intervention, Tuesdays placebo, then Wednesday intervention. Again, this is not randomization because there could be some sort of a mechanism that is making some sort of people coming Monday and other type of people coming Tuesdays, and therefore it's not randomization. Okay, so there are types of randomizations beyond the simple randomizations. So, مثلا, like, what happens if after randomization the two groups are not similar? Well, let me start saying that this is very unlikely to happen. Usually, if you've done your work well, the two groups will be similar. But it's always a good idea after you do randomization is to compare the two groups. Compare them with regard to baseline characteristics just to make sure that they're actually very simple. Okay, cluster randomization. Well, sometimes you cannot randomize individuals. Uh, you'd have to randomize group of people because they actually present themselves as groups and not as individuals. ممكن عم نعمل intervention for households for, let's say, see if I can introduce recycling. So you cannot, within the same household, tell some people, well, you're going to recycle and you're not going to go to recycle, because if we're going to provide them with recycling material, if we're going to give them different bags, then the entire family is going to use these bags. Therefore, you don't randomize people, you're going to randomize families. Other times بيكون في clinical trial that is very, very big, and it's going to be based on many medical centers that might be international. And since the researchers don't have a lot of control over what is happening in all these medical centers, what they do is they will randomize the medical centers. So مثلا بتكون international study and you have medical centers from all over the world. Um, and the research team مثلا لنقول they're in Europe, don't know exactly what is the medical hospital in Lebanon is doing and exactly how they do it, and they don't have the resources to help you randomize at your own medical hospital. So what they can do is they can actually randomize the medical centers. And for example, let's say LAU Medical Center gets to be picked to be part of the study. We could be randomized to receive only placebo. We would not know about this, and our patient would not know about this, and nobody would know about this till the end of the study. But sometimes it can be done. There's also when you're randomizing, there's something called restricted/blocked randomization, and basically what you're doing is you're not randomizing the entire. So let me start by saying this. Let's say you want to recruit 100 people in your study and you want to randomize them 50 control and 50 treatment. The simple randomization, what you do is you number them from 1 to 100, and then you split the numbers into two groups, okay? And that's simple randomization. What that would do is, if for some instance you'd have to stop your study early on, or if it turns out you're not going to be able to recruit the 100, or you need to do some interim analysis, and you find yourself stopping at 20 patients. Well, if you stop at 20 patients, there's no guarantee that 10 are going to be in the intervention and 10 are going to be in the control. You may end up 15 in one arm and 5 into one arm, because simple randomization guarantees that you're going to get 50-50 at the end of the sample. Therefore, an approach that is widely used nowadays is what they do is they take the big sample and they cut it into small blocks. So you may have a block of 4, 6, 8, and then every block is randomized. So that if for some reason you had to stop at 20, well, maybe 20 is made of 4 blocks. Maybe it was 5, 6, and 4, and another 5. No, 5 cannot be a number because it has to be an even number. But you get the point. So maybe 20 is made of different points, of different blocks. And therefore, every block has been randomized, and every block has 50% in one arm and 50% in another arm, therefore guaranteeing that by the time you finish the 20, you can be sure that you'll have 10 in one arm and 10 in another arm. So that's block randomization. Another type of randomization is called stratified randomization. And basically, stratified randomization is before you randomize, you put people into groups and then you randomize. So for example, if I want to randomize my patients, but I'm worried that because 95% of my patients are female and only 5% are males, I'm worried that I might not end up with equal number of males in both arms. So what I do is before I randomize, I stratify them into their gender. So females are going to be randomized in separately than males, and therefore I can make sure that at the end of the study I'm going to have equal number of females in both arms and equal numbers of males in both arms as well. All right, so this is all of this was about criteria for what makes a full experimental design. As we said, if you think about the RCT, then it's randomization, control group, and trial and intervention, and therefore you need to have these 3 things for your study to be fully experimental study. If you miss one of them, and when I say one of them, I don't mean the intervention, because if you don't do intervention, it's no longer an experimental design. But if for some reason you're not able to do randomization, or if you're not able to have a control group, your study is still part of the family of the experimental study, but it's not considered a full experimental study. It is considered either quasi-experimental or pre-experimental, and we'll talk about that in the following audio.